Without further ado, I'll go ahead and hand it off to Petra.
Thanks, Stephen. Appreciate everyone joining us today to learn about a breakthrough treatment for painful diabetic neuropathy. Before we jump in, I just want to let everyone know that we will be sharing the recording of this webinar afterwards. So don't feel like if you miss taking a note on something or a website link that you've missed it, we'll include that in the email follow-up afterwards. Next slide, please. As mentioned, I'm Petra from Nevro, and Nevro is sponsoring today's session. We're a medical device company and the creator of the HFX Solution, which is a spinal cord stimulation system for the treatment of chronic pain. New in our company is that in July of this year, we were approved for the treatment of painful diabetic neuropathy, and that will really be the focus for today's presentation on using the HFX Solution to treat painful diabetic neuropathy. Next slide, please. I'd like to take a moment to introduce Dr. Erica Peterson, a neurosurgeon whose research is really focused on treatments for chronic pain using neuromodulation. And kicking us off today will be Teresa Pearson, who is a diabetes expert specializing in clinical management and self-management education. And I'll hand it off now to you, Teresa. Next slide, please.
Yes, thank you, Petra. So today we're going to start talking about what is painful diabetic neuropathy. And then we're going to talk about how to talk to your doctor when you're not getting relief. So when you've tried other things and they just haven't helped, you know, how to have that conversation with your provider. And then after I've said a few things about that, then I will be handing it over to Dr. Peterson, who will then go on and talk about spinal cord stimulation. How is the HFX solution different? She will talk about clinically proven long-term relief with HFX for PDN, looking at some of the research and what to expect from HFX for your painful diabetic neuropathy, and also talking about who is a good candidate. And then we will have some time for some questions at the end. Next slide, please. So first of all, you're not alone, and you probably are well aware of the fact that there are a lot of people who have diabetes. About 20% of people with diabetes will develop painful diabetic neuropathy, or PDN. 45% of those people with PDM will not obtain relief from conventional medical management. And so we're going to talk about that group of people. And if you are among those, you might want to see if this is something. Next slide, please. So what is painful diabetic neuropathy? It is a type of nerve damage that's caused by diabetes. And you probably know that diabetes, that oftentimes if people run really high blood sugars, that things can start to happen with their eyes, their nerves, and so forth. And then in this particular case, we're talking about how high a blood sugar can injure the nerves throughout your body. And typically we will see that happen in your legs and your feet. Oftentimes that's related to your age and particularly the duration of diabetes. And it's not necessarily caused from just one or two high blood sugars here and there. It's sort of a persistent level of high blood sugars over time that moves to this level of damage. You may have had a foot exam when you've gone in to see your providers. And what they're looking for is whether you have good pulses, because we want to know if there's good circulation. And we also want to know if you have good sensations. So they might put something that looks like a fishing line. We call it a Sims-Weinstein monofilament, and they might press that against your foot and your toes and perhaps even up your calves to determine if you have good sensation or if there seems to be some absence of sensation. And there might be a variety of other things that they will do to check further the sensation, but as well looking at things like circulation. They would be looking for if your toes or your feet are really cold or if they're blue. Now, there is a difference between nerve damage and circulatory issues, but sometimes they feel very similar. So it's really important that if you're unsure that you get that checked out and get it diagnosed, Some people end up with both issues going on, but the way that we treat them are very different. So you need to make sure that you're getting it diagnosed and the right treatment for the right issue. For painful diabetic neuropathy, very common things are this shooting, burning, kind of a pins and needles pain. It might initially start out in the beginning before it gets really bad. It might just start out feeling like it's, you know, your foot has just fallen asleep, that kind of thing. But over time, that can get much worse and it can throb and so forth. So it's definitely something that you want to get taken care of. Next slide, please. So I know that if any of you have experienced painful diabetic neuropathy, you probably have tried many of the topical treatments that are available over the counter. And some people may have tried physical therapy as well. Now, some people have good results with those in the very beginning, but there's a lot of people that don't. And that in those cases, very often you'll be moved to some of the prescription medications, probably most commonly in the very beginning, gabapentin or amitriptyline, primarily because they're very inexpensive. But then there are other drugs that can be utilized, as you see on this list. What we're really trying to do is to stay away from the use of the opioids, oxycodone, tramadol, or Vicodin, Lortab, things like that we're trying to sort of stay away from now and really trying to look at better alternatives. When you look at these medications, they're not without side effects. And very often people will, one, they might forget to take the medication, but they may also feel fatigue throughout the day, dizziness. Some people gain weight with some of these medications, or just sort of, a fog, kind of a brain fog, and not being able to function the way you normally might want to, particularly in a work day. And these may not take care of your pain either by themselves, so that we know that people are not always 100% successful with these. And in fact, there's, as I said, about 45% of folks are not able to manage their pain using these treatments. Next slide, please. So when talking to your doctor, when you're not getting relief, you want to talk about it, particularly if it's something that you've tried other things and it's just not responding. It's not giving you the kind of relief that you would like to see. So if you start saying some of the things that you see down below here where it says impacted quality of life, it might mean the pain keeps me awake all night, or I have to turn down social invitations because of it. I'm not able to work like I used to be. I used to be a regular walker, but now I can barely walk to the mailbox. Or I can't do everything with my kids or my grandkids that I would like to. And if you start saying those kinds of things, it's time, at this time, you really need to be talking to your doctor about what kinds of things you can do to take the next step. You want to make sure that that you have given some try to some of the medications, but you don't want to wait too long. And I think too long is if you're starting to say some of the things that there are on the bottom of the slide here, some of these comments, then it's probably time to go in and talk to your doctor. Next slide, please. So I'm turning it to Dr. Peterson at this point.
Thank you, Teresa. I want to just share this video, which gives a little bit of an idea of how some patients who've turned to HFX as an option experience the change.
Well, I've had diabetic neuropathy for probably about 15 years. The pain would start from my back down to my hips, and then it just radiate down to my legs, my feet, my toes.
I have diabetes since I was 31 years old, and I've had neuropathy for the last 6 or 7 years. Tried just about every pain medicine, and none of them really even worked. Couldn't do anything for myself. I was stuck living with the pain.
The description that patients give for painful diabetic neuropathy is quite varied. I've had patients describe that it's like being stung. Some people get severe, intense itching. Some people have numbness and pain, which seems very paradoxical. To depression is profoundly common in this population. We haven't had effective therapies that have been a solution for us.
After my HFX implant was put in, I felt almost immediate relief. All the pain was gone.
Now I'm to the point where I'm feeling all this relief and I take zero medication for my diabetic neuropathy. It's unbelievable not having the side effects of those pain medications.
I don't have to depend on anybody else. I can finally start depending on myself. HFX is my best friend.
HFX changed my quality of life. My whole attitude has changed. I feel like I have a future.
Having something that, like HFX Solutions, that is an implantable device that doesn't require, long-term drug therapy, doesn't require a patient to suffer from side effects that the drugs really elicit, is actually really a wonderful thing to be able to offer.
I've had the honor of working as the lead for the research study that we did to prove the clinical efficacy of painful diabetic neuropathy response to HFX using a spinal cord stimulator. And I want to tell you a little bit about what that means. So when you talk about non-drug therapy, we're talking about a very small surgical procedure to implant a spinal cord stimulator device. You could think of this like a pacemaker for pain. There's a small unit which has a battery and a computer in it that's implanted underneath the skin, typically somewhere above or below the belt line. And there's little wires that travel under the skin from that unit into the spinal canal, and they deliver small impulses of electrical messages into the nerves of the spinal cord that help to disrupt the pain messages that come from the diabetic neuropathy pain in the feet and ascend and register in your brain. So the idea there is that we can block or minimize those pain signals so that people are able to get better rest or peace and quiet in their own bodies. Next slide, please. We know that spinal cord stimulation works in the past. We've seen this technology, which was developed originally more than 50 years ago, improve as we see that technology has gotten better. The computer technology, the kinds of devices, the battery life, all of those things have gotten better the same way our cell phones have gotten better over the past decade. Some of the first areas where this research was performed was looking at people who had back and leg pain after previous back surgery. And from the research there, we've had some very good results. It's well established that people respond when they have nerve damage related pain that doesn't help with medications, more surgery, or anything like that. What this device is something a little bit different. It takes that history of effective use, but using a specific patented waveform, which is at 10 kilohertz frequency. Think about how a high-pitched ultrasonic jewelry cleaner vibrates very, very quickly. That's what 10 kilohertz is like. It's a high frequency movement and vibration that changes how nerves process messages, but where you don't feel any tingling or stimulation or anything from the device itself. There are more than 70,000 patients worldwide since the FDA approval in the US in 2015 who've received an HFX device to take care of their nerve damage related pain. But the FDA only approved the use of a stimulator like this for patients with diabetes related foot pain back in July 2021. Next, please. So let me tell you a little bit what's different. The key here is, like I mentioned, the FDA approval. Because of the research that I led, we were able to show to the FDA that using the 10 kilohertz frequency, which is provided only within the HFX device, people with diabetes were able to get a significant amount of pain relief. And because that frequency has no associated tingling, vibration, or any other effects, it doesn't make any of the symptoms of the diabetic neuropathy worse. The HFX device is the only device that offers this 10 kilohertz benefit, and this is the one with science to support it and an FDA approval behind it. Next slide. What we saw in the science is really impressive. People who had severe pain, who had not had a response with medications before, who were unable to get good sleep at night, they were up every few hours to massage their feet, walk around, or building custom little tents over the sheets so that they wouldn't touch their feet at night. Those are people who responded using a stimulator. What we saw is that 85% of people in the research study had a reduction in their pain of at least 50% or more. In addition, the average reduction in pain across everyone that we studied was 76% reduction in pain. For some people, it was bigger. Overall, we saw a very significant improvement. And then when we compare that to people who didn't have a stimulator and were still using the standard prescriptions and other tricks that were available through their doctor's offices prior to a stimulator, we saw a very small response in that group. What we see is somebody whose pain score might have been 7.6 before they started using a stimulator had that pain level go down to 1.7. Next slide. You can imagine how that translates in life. If you can cut your pain by 50% or more, you're going to sleep better. And what we saw in the research was that 62% of reduction, 62% reduction in the kind of disturbed sleep that people had at night. People were able to sleep longer. People were able to sleep more soundly and without interruption, thanks to the stimulator compared with the conventional treatments. Interestingly, we also saw that people reported that a lot of the sensation changes and other neurological changes that happen related to painful diabetic neuropathy seem to get better. People reported that the pins and needles feeling went away. They could feel under their feet again. So for example, they felt comfortable to walk on grass. They could put shoes on and walk longer distances as a result. Some people's reflexes and strength were better as a result as well. And then we asked people, are you satisfied that you have a stimulator? My own patients in the research study told me this is the thing that changed my life and I wouldn't want to give it back. Or I had somebody even tell me they would sell their house if that's what it meant to get a stimulator again. Reality was 92% of people that we asked in the research study were satisfied or very satisfied having an HFX Solution stimulator to help them. Next slide. But what does it mean to have the HFX Solution? This is a small process. It involves finding an expert who knows how to put a stimulator device in safely and is trained in doing that HFX procedure. You want to speak with a pain management provider who's experienced with HFX to first of all decide if this is the right option for you. Not everybody is a good candidate. Not everybody likes the idea of having an implanted gadget as something to work on treating some of their symptoms. And so understanding what this is and how it may work for you is the best first step. The one thing I like about this as a neurosurgeon is there's a lot of operations I offer where you don't get to test it before you find out how well the surgery is going to turn out by just having the surgery. In this case, we're able to do a small temporary test trial using an HFX device for about a week to see that you respond before we put the device in permanently. The idea for this is that 2 slender wires about the thickness of a guitar string are threaded through a small needle into the spinal canal, and then those run outside the body to a little control box and you test drive it at home for the week. During that time, you want to find out how much better is pain? How sensitive are your feet? Are you able to sleep better? Are you able to cut back on some of the as-needed medications that you've been taking? And a lot of that helps you decide whether or not this will be effective for you. When our studied patients did the temporary test trial, 9 out of 10 found it successful and went on to put a permanent device in. That's a procedure that's done typically as a day procedure in a surgery center with some sedation medication and takes about an hour and a half to do. The electrode wires are threaded through a needle into the spinal canal, and then those wires are run under the skin to a separate scar where the battery pack is placed under the skin. The device is rechargeable and charges wirelessly through the skin. People go home the same day, they heal up from the surgery and begin to charge and use their device within the following week. The other thing is because it doesn't create any sensations, there's no restrictions. Some spinal cord stimulators that create vibration have cautions about using them while driving or while sleeping because they may be unpredictable in how your spinal cord responds to them at specific movements. However, the HFX device doesn't have any restrictions like that. Additionally, it's rated to be MRI conditional as long as you have the right safety settings for the MRI scan. Next slide. I mentioned a few of these previously. First of all, the little trial stimulator, that pebble there, this is the external control device that you use during the temporary test trial. It is clipped on to the side of the skin using a small adhesive pouch during the course of the trial week, and you sponge bath around the tape and everything during that small time window for the test trial. You can see there the Senza Omnia battery on the upper right. That's the generator that goes under the skin. It's about an inch or so underneath the skin. And the battery pack size is smaller than 2.5, 3 of my fingers put together. Those electrode wires you can see there, as I mentioned, about the thickness of a guitar string or a piece of spaghetti. The charger, this is an external device. That blue paddle sits over the skin and puts the electrical energy back into the generator wirelessly. Some people choose to charge their battery up a little bit every day. Some people choose to charge every few days, depending on the power draw of the device and what their schedule is. The advantage of a rechargeable battery is that you need surgery to switch out a depleted battery only once every 10 years, not more frequently, because you can top the battery up. And then finally, the remote control. This is a device that allows you to control how much stimulation therapy you receive from HFX. You can turn the device off, you can turn it on, you can turn the intensity up or down. You have all that flexibility. And if you needed to have a medical procedure, you can turn it off during the procedure as well. Next, please. So who's a good candidate for HFX for PDN? First of all, you should have a diagnosis of diabetes. Second of all, you should be diagnosed by your diabetes care team with painful diabetic neuropathy, or PDN. You should also have tried some medications. While this is a fairly minimally invasive procedure, there's still small risks associated with having an implanted device. And we want to make sure that it's not something that a trial of medication might help you with, which may have lower risks for you than any kind of implanted device in a long time. In addition to trying those medications, your pain should be severe enough to really cause disability. For most people, that means a pain score of 5 out of 10 or greater for the majority of the time. That's pain that's limiting your life, the way Teresa described. Additionally, it may be that your pain is not too bad all the time, but that the pain medications that are helping to keep it under control have such side effects that those in themselves cause you inability to function. If you take a medication that seems to be helping your pain, but makes you groggy, dizzy, or drowsy all the time, you probably shouldn't be taking that because it ultimately affects your health and safety. So some people come to me talking about wanting to consider HFX because they want to get off the medications and decrease the doses so that their overall quality of function is better. Next, please. The most important thing here is that you can get back to what you enjoy. The idea of what Mindy said, that she can sleep, that she can live her life, that she can be ready to take on a day, and not have the constant heavy drag on her of the chronic pain that she had. And recommend that you look online for some more information about her stories as well. Next. Now, this is the final thing I want to go over with you. One is, it doesn't take very much as a patient with diabetes to know that you are a proactive part of your healthcare and your best diabetes control. This is another area when we talk about PDN where you are in command and you should be driving this conversation. You know how long is too long to be trying something before it's not working. You know what the side effects are. You know what you've tried and what's been frustrating, what's helped, but what hasn't helped, and how that affects your day-to-day quality of life. Those are things that you can call into attention to your care team. You know about HFX. Does your care team know about that? If your clinician team doesn't know about HFX, you can get more information and we can provide that through Nevro to your clinical team. They can also help you with getting connected to a clinician who's an expert in the HFX solution. Finally, I mentioned the FDA approval. HFX Solution is the only spinal cord stimulator device which is FDA approved for painful diabetic neuropathy. What you want to ask your clinicians is this: do you think I might be a good candidate for HFX to treat my PDN? You want them to have a good appreciation of what your goals are and how the HFX solution might help you to make them. Also, you want to get a good idea of what that pain relief could be. And finally, you want to understand whether or not there may be issues with insurance coverage. In my office, I make sure that all of my patients have had their insurance benefits verified. And if necessary, we meet with a financial counselor to make sure that they have no surprises after a procedure. You want to make sure that you feel comfortable so that while you're working to address your pain, you don't have additional stress financially about it as well. These are questions that'll be available to you, and I recommend that you take these as part of your discussion guide to talk to your clinician team about whether or not PDN pain should be addressed with HFX for you. Next, please. So finally, we want to open things up to questions and answers with me and Teresa and Petra as well, and see what thoughts we can hear from you and what questions we can address for you about things. Part of the most important part about this is to address open dialogue, and we want to make sure that you're getting good answers from the experts. So thank you for your interest. I'm looking forward to hearing your questions.
Thank you, Dr. Peterson. And just as a reminder for everyone, within the Zoom window, right at the bottom of the screen, right below the slide that you see, there's a little icon button, a chat bubble that says Q&A, and you can put your questions right in there, and then we will serve those up to be addressed. We do have a couple of questions already, Dr. Peterson, so let me just give you the first one, which is, does this treat other types of neuropathy?
Well, so we have one of the largest research studies here for PDN. We had 216 patients in the research study showing the efficacy of treating PDN-related pain. There are other kinds of neuropathy which seem to respond, but they haven't been studied with the same strength of evidence as what we have in this research study. It's something that anybody who's interested and may have a different diagnosis should really talk to their pain provider about, because that's something that may very well depend on the kind of symptoms that patient has.
Great, thank you. Next up, we have somebody asking, just what if I haven't tried prescription medications already? I think you covered this, but just good to reiterate.
Yeah, so it takes a little bit of time to get a referral and come talk to a pain provider. And it's really during that time that you're waiting for the appointment is a perfect time to try one of the standard of care guideline supported first-line medications for painful diabetic neuropathy. The American Diabetes Association has a recommended steps to treat PDN. And if you haven't tried those medications, you should talk to your clinician about trying some of those. Certainly, if one of those medicines works, then that is a low-risk option. It doesn't involve a procedure to implant a foreign body like an HFX Solution device. Some people can stop there, at least for a little while. The other piece of that is it makes sure that you get some relief potentially while you're waiting to meet with that pain provider to talk about the HFX Solution. So talk to your diabetes treatment team about following the ADA guidelines for PDN treatment.
Great. Next question is, how bad does your pain have to be to use this?
Well, how bad pain is kind of subjective. Everybody has a different way of describing their pain. And you kind of know that. You see somebody who cuts their finger with just a little paper cut and there's wailing and screaming, and other people who just shake it off. And so it's really an individual decision on that. How bad enough that it means that you're here asking the question, bad enough that you're missing out on things. When we talk about a pain score, there's the 0 to 10 scale where 0 is no pain and 10 is the worst pain in somebody's experience. And typically the people who undergo placement of an HFX device have pain that's a 5 out of 10 or worse. Most of the patients that I see have 7, 8, or 9 pain when you ask them where they rate. I have one patient who said their pain was a 44, but it's only a 10-point scale. So really it's 44 means 10. But ultimately, it comes down to not just what the scale or intensity of the pain is, but what that means to you in terms of overall ability to function during the day-to-day and what that quality of life is for the people that are talking about this as an option.
Great, thank you. And if you could just speak a little bit more maybe about what's involved in the trial phase.
Sure. So the temporary trial is the placement of the lead electrode wires. That's done with a small amount of numbing medication and sedation. It can be done in some pain physicians' procedure rooms in their offices, or I do those procedures in a surgery center. And the wires are then come out through the skin under a lot of tape and are connected to that little control temporary trial device that I showed in that one picture. During the course of the week, you're able to adjust the device. You turn it up and down, off and on, and you work with an HFX coach. That is specifically assigned to you, individual who is going to help facilitate how the test trial process is going. They want to know how your pain relief is. They want to know how you've been sleeping and moving around and being active. And based on how things are going, they'll make recommendations about the settings on the device that you can adjust using your controller at home. At the end of the course of the trial, those temporary wires are removed and you make a decision. Was the test trial successful enough that you would want to have that kind of relief permanently? And when I talk to my patients who are coming for placement of a permanent HFX Solution device, what I tell them is what I'm aiming for in placing the device for good is the same kind of relief they had during the temporary test trial.
Thank you. One more is just, what does the recovery period, entail after getting the permanent implant?
Different doctors who do these implants have different requests for activity restrictions and recovery. It's a day procedure. Most people are sore from the procedure for several days after. The wires are balanced underneath the bone in the spinal canal, and your body will knit a scar capsule around those wires over the first 4 to 8 weeks after surgery. That helps to prevent things from shifting or moving. It's just a protective way that our bodies wall off that foreign material. And while that scar capsule is developing, I generally ask people to take it easy in terms of strenuous lifting, twisting, fairly vigorous things, just for the healing up so that those wires where they're balanced will stay in position. Most people are ready to get back to work within a few weeks' time, but the specific recovery will be something that you should talk about with your pain physician prior to undergoing the trial and permanent implant procedures.
Great, thank you. This is a great question. I know I see often is, can I get an MRI?
Absolutely. This device is MRI conditional. It's rated for both 1.5 Tesla strength and 3 Tesla strength, which is one of the highest strength available scanners publicly available, as long as the scan is done using specific safety settings. And the Nevro website and the Nevro technical support team all have the information about what those settings are and how to go about safely getting an MRI scan with the device.
Great, thank you. And then, similar, we've got also is, what if you have a pacemaker?
Yeah, so I have some patients who have both a heart pacemaker and one of these implanted stimulator devices. You want to make sure from a heart health point of view that you're healthy enough for surgery. When I do these procedures, I still need from an anesthesia point of view to make sure that somebody is not a health risk for the procedure. So we work very closely with the patient's cardiology team to make sure that they can be safely off blood thinners, for example, make sure that their heart is healthy and strong so that we won't cause them any detriment by doing the procedure. The device itself, because it's placed at a distance from where the heart pacemaker is, generally doesn't interact, and we just make sure that there's no cautions or interference between the two devices.
Great, thank you. One more again is, are there just any general conditions that would make me, not make me a good candidate for HFX?
Yeah, so this is again something that is person to person specific. Most people could be candidates, and I talk to a lot of people with various conditions and other medical considerations and diagnoses. There's a few things that are worrisome. One, if you have an open wound that's infected or not healing, we want to make sure that potentially puts you at a higher risk for infection, and we want to make sure that that is something that is well addressed. Somebody who is currently sick or having an infection, we would put the procedure off until that's resolved. If somebody's on a blood thinner and can't come off the blood thinner safely because of severe risk of heart attack or stroke or other issues, then that's a person who may not be eligible, or if they have some other reason that they couldn't have anesthesia. Besides those, the majority of people are probably good candidates. There are specifics that need to be discussed with your pain physician before you go forward.
Great, thank you. Now, there's one question, a couple of questions here. I will go ahead, give you a little break, a chance to have a sip of water. A couple of questions I will answer is, one, I've seen a couple of questions about this is, how can I find a provider, offering the HFX solution, or where is Dr. Peterson, located? And Dr. Peterson is not the only doctor, offering this. The HFX solution is offered, nationwide. And you can visit www.hfxforpdn.com. And in the top right, click Find a Physician, and then you can just type in your zip code. and find a pain management provider near you that, you can reach out to schedule a consultation and, as Dr. Peterson discussed, see if this is a solution that would make sense for you. Now, I know I just read out that website URL, so don't worry about if you missed writing it down, because we will send it in the follow-up email with the recording of the webinar as well. So you'll have that. One other question that I know I see quite often also is, will this be covered by my insurance? And HFX is covered by all major insurance plans, including Medicare and Medicare supplemental. Of course, any specific plan questions related to coverage or costs really vary upon your individual plan benefits, and those would be best to discuss with your provider offering the HFX solution, similar to just as Dr. Peterson mentioned, that the team will be verifying your coverage prior to moving forward. Yeah, let's see. One other question I've seen come through, Dr. Peterson, is will it help with loss of sensation in my foot?
Yeah, so what we saw in the research study was about 62% of the people in our research study had a neurological improvement, whether that was strength, sensation, reflexes, and a large proportion of those were people who did have sensory improvement. Some of that we saw right away with the trial stimulator. Others of that, it took time after the permanent stimulator was already in place to see that change. So it's hard to say, more than 50% of people saw some sensory changes that were improvements, but it's not for everybody. And it's not necessarily immediate. And part of that's because we don't really know exactly all of the different pathways that are being changed with the stimulator. I think it's one thing, which is that if you have a lot of buzzing or pins and needles, tingling, itching pain in your feet, and you can actually get some quiet, it's kind of like being in a loud restaurant where the band is going and there's music and everything, and all of a sudden people cut that off. The band's quiet and you can actually hear the conversation at your table. Think about if all that buzzing and tingling and everything was able to be turned down, and now you can actually hear the quiet amount of sensation that's still there. So I think some people during the temporary trial realize that they have more sensation left than they thought they did, because now some of the pain noise has been tuned down. Now, some of the other people may not have noticed that, but we potentially see a longer term change, and we're not sure exactly what causes that longer term change yet. We're seeing some science continuing to be done, some additional research to figure out those explanations on things.
Great, thank you. Related to that, is just also, to address is not just will that improve it, but will it stop further, deterioration of the nerves?
That is something that we're not sure about yet. We do some research to see. I'm hopeful for that, but it's hard right now to say that it is something that is reversing nerve damage. One of the things that we know is that the better hemoglobin A1C level is, the more tight glucose control is, the less vulnerable nerves are to continuous damage. There may be a benefit that comes from using a stimulator in terms of long-term improvement, but it is too early to say that.
Great, thank you. One more here, and then Teresa, maybe you can, take the part 2 of this a little bit, speak to it is, but Dr. Peterson first is just, how does it affect your ability to know if you have injured yourself, since it's blocking, right, the pain receptor? So going back to the importance of those self-checks.
I love that answer, that question, and it's a really good one to think about, because what ends up happening actually is that your spinal cord is not just all one kind of message fiber. It's more like a braid of different kinds of fibers. Think about if you ever cut a telephone cord open and you saw all the different little rainbow colored wires in it back in the day when we had wired phones. The nerve damage related pain travels on a specific kind of fiber, and that is different from the nociceptive fibers that transmit injury related pain. So when you step on something sharp, that's traveling on a nociceptive fiber, which is a C fiber, whereas if it is nerve damage pain, it's traveling on a different kind of fiber called an A delta fiber. And so what we find selectively is that HFX seems to block the transmission along those nerve damage pathways, the A delta fibers, but it doesn't block what's happening with the C fibers where the acute pain message is. So what that means is that typically you can tell that you've injured yourself even while blocking the nerve damage pain. The other thing is you have a remote. You can turn the stimulator off at any point and just do a body survey and say, am I feeling my regular old pain or is this something different? And that's another way to be able to just check in. And I've had a few people have turned their device off and go, oh yeah, there's old familiar pain. Turn that stimulator back on again.
Great, thank you. And then, related on that note, Teresa, just, in general, can you address a little bit in terms of, recommended, frequency for self-checks and, steps to take there?
Yeah, absolutely. I think with all of this, you will find that your diabetes team and then your pain specialist will be working closely together, should be working closely together and still making sure that you're doing things like keeping your blood sugars where they should be, as Dr. Peterson mentioned, that you don't want to further the damage. So managing your blood glucose continues to be still very important, but it's also checking your feet and checking your legs on a regular basis, depending upon how far up that damage goes, that you want to make sure that you're not getting any blisters, that your shoes are well fitting. If you do have any loss of sensation in addition to the pain, then sometimes you're not realizing that those socks bunched up and now you've got a sore spot that, maybe it starts out as a reddened spot and it could quickly move into a blister, and then if you're not paying attention to it, could become an open wound. And that, along with elevated blood glucoses, you could actually end up with an ulcerated sore, and you just don't want to go down that path. So we recommend that you check your feet on a regular basis, at least once a week, if not every day. Every time you take a shower or a bath, just take a look at your feet to see how they are. Check your shoes regularly, making sure that you don't have a stone or a pebble or something that got in there while you were out on a walk. And then, of course, just sometimes some things that we may not think about. We get a new pair of shoes and go out for a long walk, or we do something like I had a patient of mine who had gone to the state fair with a pair of brand new sandals and came back, didn't even realize that her feet were so reddened and in some cases blisters. So those are just things that you need to be doing on a regular basis to take care of your feet, along with working with your diabetes care team and your pain specialist.
Great, thank you. One other question we've got is, Dr. Peterson, I already have an SCS device. Can I still get this?
Well, it would possibly depend. So I would recommend that you talk to your pain doctor about what kind of SCS device you have, where within the spinal canal it is, and there may be some solutions that, depending on where and what type of device it is, can be found specifically to your situation. There are some people who will decide to switch from one brand to another because a certain kind of pain is beneficial or needs more addressing than the stimulator they have. And I often see patients where we end up switching from one company to HFX in order to get them better relief.
Great, thank you. One other question we have is just, it's related to, the device helping with pain, but in terms of, the numbness. And I know you spoke to this already a little bit, but how long, this is an impossible question, how long would somebody, expect to wait to see that kind of result? Or is it just really going to be a case-by-case basis?
Right now, what we've been able to observe, the research that we did was focused on pain first. We knew that pain disrupted sleep. We looked at sensation because we knew, as Teresa was just talking about, the ability to feel your feet means you can protect your feet. And that means that you're at much lower risk of having wounds or even potential risk of amputation. And so we wanted to see if sensation was something that might respond. There is more research to come in looking at sensation and what that means, including the time course of how that might happen. But right now, the main understanding that we have is looking at pain and the implications of pain. The sensation findings were a nice surprise that we found along the way.
Great. Another sensation, it's the topic of the day, but would this help with a sense of balance? And does it limit physical exercise?
So having a stimulator does not limit exercise. My restrictions for patients are typically in the first month or two after they've had their implant completed, just as they're healing. But I want people to be out and be active. I have people with stimulators who've gone backcountry canoeing. I have people who are climbing ladders as industrial HVAC installers. There are people crawling under buses doing machinery mechanic repairs. I even have a few people who've gone back to the active duty in the military with a stimulator device. And so there are a lot of things that you can do. As far as helping balance, there's a lot of challenge to balance. That's not just about how you feel under the floor, but it also has to do with how your inner ear organs manage your vestibular balance. It has to do with your own position processing, and that is not specifically related to foot pain. And so if balance is one of your biggest issues, you need to be talking about that specifically. There are components of that that might get better when you improve the diabetic neuropathy in your feet, but there may be other reasons that you're feeling tipsy, and then those need to be addressed separately.
Great, thank you. And then, covering the activity portion of it, because it is just a slightly different, but could somebody swim with the device? And I know, temperatures are dipping, but it'll be summer soon again.
Absolutely. Now, during the temporary test trial where there's tape and the wires coming out through the skin, I ask people to sponge bath and keep the tape dry and not go swimming until those temporary test wires are removed. After the permanent device is placed, I ask people not to submerge in standing water, including pool, lake, etc., for about 6 to 8 weeks until the scars are nice and tough and healed. One of the things I worry about people with diabetes is that they have a slightly higher risk of wound healing issues. And so it's really important that we watch those scars and make sure that things are healed before anything that might be floating in the surface of the water could potentially compromise an otherwise working situation. But after the things are healed, the scars look good, swim, yeah, absolutely. Go swimming. In fact, I have patients with stimulators who've gone scuba diving.
Love it. I love it. Cool. A couple more questions around this topic is, will this device help with your hands?
Yeah, so the research study that we completed looked at the painful diabetic neuropathy in feet. Certainly it makes sense. The same process of what causes diabetic neuropathy pain in the feet is what's going on in hands. But our research and the FDA approval, because the science was focused on the research looking at feet, is focused specifically on painful diabetic neuropathy of the feet. If you're interested in addressing hand symptoms as well, that's something that you may be able to talk to your pain clinician about, and there may be some solutions that involve a stimulator for that, but it would be what we call off-label. That is not approved by the FDA for that use right now. But there is a lot of research using HFX for chronic neck, arm, and trunk pain in placing the stimulator leads up in the cervical canal, that's the spinal cord in the neck, in order to get relief of neck pain, shoulder pain, and arm pain. That's been looked at for people for various neck and arm pain conditions, but not specifically been researched yet for painful diabetic neuropathy of the hands. So I hope that helps a little.
Yes, thank you. Great question is, how long will it take to heal if you're working? So maybe both for addressing temporary and permanent.
Yeah, so healing time is one of those things that, I have that conversation with patients about how much time is your body going to take? How much time can you actually get off work in terms of light duty or not doing things? Depends on the kind of work that somebody's doing. If I have somebody who's doing desk-based remote work from home, they may be back to work pretty quickly because it's not a very high demand job. But one of those school bus mechanics I talked about who's crawling under buses and on dollies and things like that, it's a higher demand occupation, and we may ask for more time off work to allow for healing. That's a conversation one-on-one that a patient and their implanting physician should have so that they can manage their time expectations appropriately. I certainly wouldn't say that that's a deterrent from having the conversation.
Excellent. I love this question is, do you use the same wires for the permanent implant that are used for the test period, for the temporary trial?
Great. So essentially, they're the same kind of wires, although the temporary test wires those are removed and discarded at the end of the trial, so those aren't sterile anymore. So we use brand new packaged sterile at the time of implant in the procedure wire electrodes for the permanent stimulator, but they go into a very similar location and they're very similar in shape and design to the temporary test wires.
Great. One more. I love you guys. Keep the questions coming in. It's great. We'll go as long as we can. But one more is, can you use a TENS device for, it sounds like, a separate back issue while you would have this device, implanted for treating painful diabetic neuropathy?
There may be a little bit of a challenge depending on where the TENS stickers are going and how close that is to the implanted device stimulator pack. And so that's something that you could talk to your HFX coach about and figure out two things. One is, before you put the stimulator in, where would you want that battery pack, power pack to go underneath the skin so that it's comfortable for you? And the other thing is then afterwards, where could you really safely put the stickers if you needed them? The other thing I'll mention is that some of our patients who have painful diabetic neuropathy also had back pain. And when the stimulator was activated for their foot pain, their back and hip pain got better too. So you might not need the TENS unit if you're lucky.
Great. And then I know I will just add that you mentioned asking an HFX coach. So just for everyone on the line, we've mentioned, taking that assessment at www.hfxorpedian.com to see if this solution looks like it may work for your type of painful diabetic neuropathy. Once you go through that assessment, and if you submit your information, there's a collection field for your phone number. It's completely optional for you to provide it, but if you do provide it, then an HFX coach will reach out to schedule time for a free consultation with you and address any questions super specific to your individual case that you may have, and they would help you and advise on next steps through the process as well. One other question here I see is just, what is the difference between the HFX Solution and other SES devices? And we've just got a few minutes. So if you could, we'll take this one, I think, as our last one.
So there are about 5 or so a decent handful of manufacturers of stimulator devices that are FDA approved and on the market in the US. They have nuances to them. Some people will say it's kind of like there's a lot of different brands of pickup trucks. What the engine is under the hood, where the cup holder is, all those things are different truck to truck. Similarly, the difference is here. Nevro's HFX device is patented at 10 kilohertz. They're the only company that can deliver that frequency of stimulation and that has the science to support it for painful diabetic neuropathy. Other brands can deliver stimulation at up to like 1,000 hertz, which is 1 kilohertz, but the 10 kilohertz band is patented and protected by several patents. And so that is one access area. There are other nuances to how the little remote controller looks, rechargeable or non-rechargeable, different degrees of MRI access that are all possibilities. And if you talk to a knowledgeable pain practitioner, they probably can give you a rundown comparing different devices and what their ups and downs are. When I'm asked in my own practice how I pick a device for a patient, I really try to match the individual patient's needs and goals to the kind of device that I think is going to best get them there. And the first thing that I look at is, what is the evidence of the kinds of results or outcomes that I can get for those patients based on the science that's out there. Right now, because of the FDA approval, because of the science that I got to lead, I know that the strength of the science is with the HFX solution for people with painful diabetic neuropathy. For other conditions, it might be that I look at a different kind of stimulator because I have a patient who has a specific kind of issue that we need to tailor to something else that's available. And those are conversations that I have one-on-one with my patients.
Great, thank you. We're just about out of time, and I want to respect everyone's schedule. So thank you very much. We've gotten through all of the questions. So, if anyone has any additional questions, we're going to address this, Stephen, on the next slide, if you want to jump to that. Any additional information, you can visit, again, at www.hfxforpdn.com. You can navigate around the site. You can go deeper, watch a video into how the HFX solution works. There's an entire page about, again, addressing what to expect as you go through the temporary trial and the permanent implant as well, and some common top FAQs there as well. And on the website as well, Dr. Peterson referenced earlier, Mindy Neal's story. There's additional, patient stories. You can watch their videos on the website as well as hear what, some other physicians are saying about the HFX solution. Just, to wrap up, as a reminder, we will be sending an email with a recording of this presentation and some of those key website links. So if you're, if you want, you could take a screen grab of this if you're that super proactive, but we will also send an email out with those links for you. And again, just to reference, there is that assessment on the website. You can see if this looks like, if the HFX solution looks like it would be helpful for your painful diabetic neuropathy. And again, it's completely optional, but just, for context, if you do provide that phone number, that is what allows an HFX to reach out, the HFX coach to reach out to you and schedule a free consultation and answer all of your questions. No time limit, no 1 hour time limit, but they'll be able to answer all your questions and help advise on the next steps forward. And then finally, on the website, again, in that top right corner, you can click Find a Physician and enter in your zip code to see pain management providers near you in your area. And that wraps us up. Stephen, if you want to take us to the next slide, I just want to thank all of the attendees, for joining and for your engagement. Some really great questions. And also, of course, thank you to Dr. Peterson and Teresa Pearson. Appreciate your time so much. And thank you on behalf of everyone else that joined as well.
Thank you.
Thank you.
Thank you, everyone. Bye-bye.
Bye-bye.